In the final part of the training program, we're going to talk about your patient and age-related hearing loss and what you could do to best communicate and help your patient. The most common type of hearing loss is presbycusis. This is age-related hearing loss that is sensorineural in nature and occurs in the cochlea. It is affecting an increased percentage of the population as we age and experience greater amounts of noise exposure. For patients suffering from presbycusis, hearing loss tends to be worse in the high frequencies than in the low frequencies, and many perceive conversational speech as too soft or mumbled. The common complaint is I can hear you talking, but I can't understand what is being said. The patient recognizes that speech is happening, but because they are missing much consonant information in the higher frequencies, they cannot determine what is being said. Someone with a mild hearing loss will recognize somewhat more than someone with a severe hearing loss. And a patient who is a good speech reader will do better than someone who is not. How well an individual concentrates on the message influences the message's reception. For example, if a patient is stressed, anxious, fatigued when engaging in conversation, they will struggle to follow your message. The patient with hearing loss may bluff or pretend to understand what you're saying. The patient may withdraw socially to avoid communication difficulties. The patient may dominate conversations so to always know what is being talked about, or the patient may succumb to feelings of anger, hostility, or self-pity. Hearing loss is an invisible condition, and the consequences may be manifested in a broad spectrum of the individual's life, including in their home, at their workplace, and in their community. There are psychosocial consequences of hearing loss. An older person with hearing loss may demonstrate anger, frustration, antipathy, or fear. Their communication partner may feel impatience, annoyance, frustration, or sympathy. Negative social reactions may lead to emotional distress, which may lead to social withdrawal, which could lead to depression and many other problems. When you're having a conversation with a person that has hearing loss, interruptions are more likely to occur. There may be more questions for clarification, or misperceived messages will be asked. A greater effort needs to be made to ensure that the person with hearing loss has the opportunity to contribute to the topic's development. The person with the hearing loss may contribute remarks that are not relevant to the conversation. There may be disrupted taking of turns. The person with hearing loss may not hear the intonation contour at the end of a sentence. Thus, there may be inappropriate silences because the person did not know to initiate a conversational turn on cue. There may be inappropriate topic shifts. The person with the hearing loss may not recognize your previous remarks. They may inadvertently and sometimes inappropriately change the subject. You might speak using more superficial content because speech recognition is difficult for the person with hearing loss. They may avoid certain topics of discussion. There may be frequent breaks for clarification. Misunderstandings are more frequent. They may need to engage in clarification more often, and diversions from topics may occur regularly. There are communication strategies, which are methods that you can use to help improve the communication flow and understanding. First, create an appropriate environment with quiet, without background noise. Your environment should be well lit, without light shining in the person's eyes. You want to stand a good distance from your communication partner, avoid visual distractions, and be at a good viewing angle for the talker. Use appropriate speaking behaviors. Speak clearly and slowly. Speak with your face towards the hard of hearing individual. Avoid putting objects in or near your mouth while you are speaking. Stand away from windows or bright light sources when talking to someone with a hearing loss. Display empathy. Lip reading is a very difficult task. There is stress and anxiety associated with the hearing loss. There is also fatigue and a desire for social withdrawal. Organize your message so that you avoid verbosity. Use concise and syntactically simple sentences. Avoid ambiguity by using precise terminology. For example, this sentence, "Geez, you should have seen the game Friday, would have blown you away," is difficult for a person with hearing impairment to understand because it is spoken quickly, there are blurred word boundaries, and some of the word sounds are omitted. When spoken slowly, "You should have seen the game Friday," would have blown you away, and it can be revised to be even easier. "I saw the baseball game Friday. The game was great." This is easier because it uses simple syntax. There is a repetition of the important keyword game. 2 sentences are used rather than one long sentence. There are no ambiguous references such as "it," and there are no colloquialisms such as "blown you away." Comprehension. Ask your patient if they understood your message. Ask for verification and listen if the person with hearing loss can repeat or paraphrase what you just said. Provide feedback whether the individual correctly recognized the message or not. An overview. It is important to set an appropriate environment, to use appropriate speaking habits, display empathy for the challenge of having a hearing loss, organize your message using simple sentences, and ask your patient if they understood your message. Be mindful of these factors, and this will help you to decrease the negative psychosocial effects caused by your patient's hearing loss. To summarize and review, a large percentage of our population suffers from hearing loss, which is an invisible condition. Cochlear hearing loss is irreversible. Due to the nature of cochlear hearing loss, your patient may recognize that speech is occurring, but have trouble understanding the whole message. Assisted listening devices may be used to help improve understanding. Control your environment. Use appropriate speaking habits. Modify your message and display empathy. Please click on this link below to complete the survey about hearing loss.